Lots of people have high blood pressure. We think that about 40% of the Scottish population have high blood pressure, and that increases their risk of cardiovascular disease. It also takes a lot of resource for the NHS. So pre-COVID, we know that there were in Scotland 1.2 million primary care appointments each year just for measuring blood pressure. The telemonitoring solution means that people don't have to go into the surgery to get their blood pressure taken. People have a blood pressure monitor to use at home. They get a text to say, can you take your blood pressure? They do that and they text in the reading. They then get some feedback. It says your blood pressure is a little high. Follow your action plan. Your blood pressure is very high, and there are specific instructions then, or your blood pressure is okay.
This is a supported system because it's telehealth. If there are concerns, a practitioner notices that the blood pressure is getting high, they can contact the patient, ask them to come in and change their medication. And it's a much more sort of a two-way process of working together. Rather than just being left to, you might have your annual checkup, but by that time, things could be actually, really needing attention. And it's now become part of usual care in many areas of Scotland.
What the patients are saying to us is that it empowers them, and they feel that they can have a much more informed conversation. The impact has been huge. Over 70,000 people have actually used the system. Some for long-term monitoring and some for diagnosis of hypertension.
Now we are looking at the long-term outcomes of people who have continued using telemonitoring for many years, and looking at outcomes such as stroke and heart attacks, to see if there's an improvement in their blood pressure over years when they've been using telemonitoring.
It's very satisfying to be able to contribute something. My background is in community nursing, practice nursing, so I have seen this, and it just seems like such a sensible idea for people to be doing this rather than coming in for lots of blood pressure checks.